Imagine this. It's 2:17 a.m. The house is quiet, you are finally sleeping deeply, and then your bladder wakes you up again. You sit on the edge of the bed, tired, a little frustrated, wondering, why does this keep happening every single night? You're not alone. Millions of adults over 60 wake up 2, 3, even 4 times a night just to pee, and most people are told that's just aging. But what if part of the problem isn't your bladder at all? What if your body has simply forgotten how to support it? Today, I want to share something gentle, practical, and science-backed that many seniors have never been told about. And it starts with a few simple exercises. Nighttime urination has a medical name, nocturia, and while prostate changes, bladder sensitivity, medications, and hormones all play a role, there is another major factor that is often overlooked: muscle weakness and poor coordination in the lower body. As we age, certain muscles quietly weaken, especially the pelvic floor, deep core, hips, and legs. These muscles don't just help you move, they help support your bladder, control pressure inside your abdomen, and signal your brain when it's truly time to go. When these muscles are weak or stiff, the bladder feels pressure even when it's not full. That pressure can trick your brain into thinking, you need to pee right now, especially when you lie down at night and fluids shift in your body. This is why many seniors notice they don't go as often during the day, but the moment they lie down, the bathroom trips begin. Now here's the good news. Research shows that gentle, targeted exercises can improve bladder control, reduce nighttime urgency, and even increase the time between bathroom visits without medication. These aren't intense workouts, no jumping, no gym, just slow, controlled movements that reawaken muscles that have gone quiet over the years. Before we talk about the first exercise, let's clear up a common misunderstanding. Many people think bladder issues are only about the bladder. So they focus on drinking less water, avoiding fluids after dinner, or just living with it. But dehydration can actually irritate the bladder, making urgency worse, and holding it too long during the day can confuse bladder signals at night. The real goal is balance, and muscle support is a big part of that balance. The first exercise focuses on the pelvic floor, but not in the way you may have heard before. Many seniors are told to do Kegels, but they're often taught incorrectly or done too aggressively. When done wrong, they can actually increase tension and make urgency worse. This approach is gentler and more effective. Sit comfortably on a chair with both feet flat on the floor. Your back is tall but relaxed. Take a slow breath in through your nose. As you breathe out through your mouth, gently imagine lifting the muscles that would stop gas, not forcefully, just lightly. Think of it as lifting a tissue with a feather, not squeezing a fist. Hold that gentle lift for 3 seconds, then completely relax for 5 seconds. Relaxation is just as important as the lift. This gentle lift and release helps retrain the nerves between your bladder and brain. Studies show that when pelvic floor muscles can fully relax and contract smoothly, bladder urgency decreases, especially at night. Do this 5 to 8 times, once in the morning and once in the evening. More is not better here. Gentle consistency is what matters. Now let's talk about the second exercise. And this one surprises many people because it involves your hips. Tight or weak hip muscles can pull on the pelvic floor and bladder area, increasing pressure when you lie down. Over time, this constant tension can trigger nighttime urges. For this, you'll need a bed or firm couch. Lie on your back with your knees bent and feet flat. Let your arms rest comfortably at your sides. Take a slow breath in. As you breathe out, allow your knees to gently fall outward a few inches, like opening a book slightly. You should feel a stretch in your inner thighs and hips, but no pain. Hold for 5 seconds, breathing calmly, then bring the knees back to center. This movement improves blood flow to the pelvic region and reduces tension around the bladder. Many seniors report that after a few weeks of doing this daily, their nighttime urgency feels less panicky and more controllable. Repeat this movement 6 to 10 times, preferably in the early evening, not right before bed. Something important to understand here is timing. Exercises that calm and relax muscles are best done earlier in the evening, while more activating movements are better during the day. This helps your nervous system wind down at night instead of staying on high alert. Now, the third exercise begins to connect your core and breathing. As we age, we often breathe shallowly into the chest instead of deeply into the belly. Shallow breathing increases abdominal pressure, which presses down on the bladder, especially when lying flat. Sit or lie down comfortably. Place one hand on your chest and one hand on your belly. Take a slow breath in through your nose, letting your belly rise while your chest stays relatively still. Then slowly breathe out through your mouth, feeling your belly gently fall. As you exhale, imagine your bladder softening and settling, not pushing or tightening. This type of diaphragmatic breathing has been shown in clinical studies to reduce overactive bladder symptoms by calming the nervous system. When your body feels safe and relaxed, the bladder becomes less reactive. Practice this breathing for 2 to 3 minutes, once or twice a day. At this point, many people ask, how long before I notice a difference? Some seniors feel subtle changes within 1 to 2 weeks, fewer urgent urges, slightly longer stretches of sleep. For others, it may take 3 to 4 weeks. What matters is consistency, not intensity. We've covered 3 gentle exercises so far that focus on support, relaxation, and communication between your muscles and bladder. But there are 2 more exercises that play a powerful role in reducing nighttime bathroom trips, especially by improving circulation and leg strength, which directly affects how fluids move in your body at night. And this is where things get really interesting, because one of the biggest reasons seniors wake up to pee isn't just the bladder. It is fluid pooling in the legs during the day and shifting back into the bloodstream when you lie down at night. During the day, especially if you sit for long periods or don't move your legs much, fluid slowly collects in your lower legs and ankles. You may notice a little swelling by evening, even if it's mild. When you lie down at night, that fluid doesn't stay in your legs. It moves back into your bloodstream, travels to your kidneys, and suddenly your body produces more urine. That is why you might feel fine during the day, but start waking up again and again once you're in bed. This brings us to the 4th exercise, and it's one of the most practical ones for reducing nighttime bathroom trips. This exercise is simple calf and ankle pumping, but done with intention. You can do it seated or standing, holding onto a chair or wall for balance. If you're seated, place both feet flat on the floor. Slowly lift your heels up, keeping the balls of your feet on the ground, as if you're pressing down on a gas pedal. Hold for 2 seconds, then slowly lower your heels back down. Then reverse it. Lift your toes up while your heels stay on the floor, hold for 2 seconds, and relax. This pumping motion acts like a second heart for your legs. It pushes fluid back up toward your torso earlier in the day, so there's less fluid left to shift at night. Studies on circulation in older adults show that regular calf activation can significantly reduce nighttime urination caused by fluid redistribution. Aim for 10 to 15 slow pumps in each direction, once in the afternoon and once in the early evening. What's important here is not to rush. Slow movements give your veins time to move fluid upward. Many seniors make the mistake of bouncing quickly, which doesn't have the same effect. Now let's talk about the 5th exercise, and this one ties everything together: balance, leg strength, and bladder control. As we age, weaker thigh and glute muscles can affect how pressure is managed inside the pelvis. Stronger legs don't just help you walk safely, they help stabilize your pelvis and reduce unnecessary pressure on the bladder, especially when changing positions in bed. For this exercise, stand behind a sturdy chair and hold the back for support. Place your feet hip-width apart. Slowly bend your knees just a little, as if you're about to sit down, then slowly straighten back up. This is not a deep squat. Think of it as a gentle sit and rise. Keep your chest tall and your breathing calm. Inhale as you lower slightly, exhale as you stand back up. Even this small movement activates large muscle groups that improve circulation and pelvic stability. Research shows that lower body strength training, even at low intensity, is associated with fewer urinary symptoms in older adults. Start with 5 repetitions. If that feels easy, work up to 8 or 10 over time. Do this once a day, preferably earlier in the day rather than late at night. Now, here's something very important that often gets missed. These exercises work best when paired with awareness during the day. If you rush to the bathroom just in case every hour, your bladder never learns how to hold a little more comfortably. On the other hand, if you hold it too long, you can irritate the bladder. The goal is gentle retraining, going when you feel a true need, not panic urgency. Also, be mindful of how you sit. Slouching compresses the abdomen and puts pressure on the bladder. Sitting tall, even for a few minutes at a time, gives your bladder more space and reduces false signals. Another small but powerful habit is elevating your legs for 20 to 30 minutes in the late afternoon or early evening. Lying on a couch with your legs supported by pillows helps fluid move out of your legs before bedtime, reducing nighttime urine production. This isn't an exercise, but it works hand in hand with the movements you're learning. At this stage, many seniors start noticing something subtle but meaningful. They may still wake up at night, but the urgency feels calmer. They can roll over, take a few deep breaths, and sometimes even fall back asleep without getting up. That's a sign your nervous system is changing, and that's a very good thing. One thing to be patient with is sleep itself. Poor sleep makes bladder symptoms worse, and bladder symptoms disrupt sleep. It's a cycle. These exercises help break that cycle slowly by teaching your body safety, support, and control again. It's also worth mentioning medications briefly. Some medicines, including those for blood pressure, can increase nighttime urination. Never stop a medication on your own, but if nocturia is affecting your quality of life, it's worth discussing timing or alternatives with your healthcare provider. As you practice these exercises over days and weeks, think of them not as a cure, but as a conversation with your body. You're reminding muscles how to support you, reminding nerves how to stay calm, and reminding your bladder that nighttime is for rest, not constant alarms. We've now covered all 5 exercises and the key habits that make them work. The final piece is understanding how to put this into a simple daily routine that feels realistic, not overwhelming, and how to know if what you were experiencing is normal aging or something that needs medical attention. Let's bring everything together in a way that actually fits into real life, because the best routine is the one you'll stick with. A simple daily rhythm works best for most seniors. In the morning, after you wake up or after breakfast, do the gentle pelvic floor lift and release for a few repetitions, followed by 2 minutes of calm belly breathing. This sets the tone for your nervous system and helps your bladder stay relaxed throughout the day. Later in the afternoon, especially if you've been sitting, do the calf and ankle pumps. This is a perfect time because it helps move fluid out of your legs before evening. In the early evening, before dinner or an hour or two after, do the hip opening movement on the bed or couch and the gentle sit and rise exercise using a chair. Then finish with a minute or two of slow breathing. Altogether, this takes about 10 to 12 minutes a day. No special equipment, no floor exercises if you don't want them, and nothing that should cause pain. Mild muscle warmth or a gentle stretch is normal. Sharp pain is not. Now let's talk about what's normal to feel as you begin. In the first week, you may notice more awareness of your pelvic area or bladder. That's actually a sign your brain is paying attention again. Some people worry this means things are getting worse, but in most cases, it's just part of the retraining process. By the 2nd or 3rd week, many seniors notice fewer sudden urges and longer stretches of sleep before the first bathroom trip. It's also common to still wake up once at night, especially after age 60. Waking once is often considered within a normal range. The goal isn't perfection. The goal is better sleep, less urgency, and feeling more in control instead of being startled awake. However, it's important to know when nighttime urination is not just a muscle or habit issue. If you're waking up with pain, burning, blood in the urine, sudden swelling, shortness of breath, or if nighttime urination began very suddenly, those are reasons to talk to a healthcare provider promptly. Conditions like urinary tract infections, uncontrolled diabetes, sleep apnea, or heart issues can also cause frequent nighttime urination, and exercises alone won't address those. That said, for a very large number of seniors, especially those who have been told everything looks normal, these exercises can make a meaningful difference. They work because they address how the body functions as a system, not just one organ in isolation. Another powerful mindset shift is letting go of fear around nighttime waking. Anxiety increases bladder sensitivity. When you wake up and immediately think, Oh no, here we go again. Your nervous system goes into alert mode, and the urge intensifies. Instead, try pausing, placing a hand on your belly, and taking 2 slow breaths. Sometimes the urge passes, sometimes it doesn't. But either way, you're teaching your body calm instead of panic. Over time, that calm response can be just as important as the exercises themselves. You may also notice improvements beyond nighttime urination. Better balance, stronger legs, easier movement during the day, and more confidence getting out of bed at night. These are not small wins. They directly affect independence and quality of life. What I want you to remember most is this: waking up to pee every night is not always an unavoidable part of aging. In many cases, it's a signal that certain muscles and systems need gentle attention, not harsh treatment or resignation. You're not broken. Your body is adapting, and with the right support, it can adapt in a better direction. We've now covered the full explanation. All 5 exercises, how and when to do them, what to expect, and when to seek medical advice. Before we finish, let's slow everything down for a moment and put this into perspective. If you've been waking up night after night to use the bathroom, feeling tired, frustrated, or worried that this is just how life will be from now on, I want you to hear this clearly. Your body is not failing you, it's communicating with you, and in many cases, it's asking for support, not surrender. Aging changes the body, yes, but it does not mean you automatically lose control, comfort, or dignity. What we've talked about today shows that something as simple as gentle movement, calm breathing, and better muscle support can make a real difference. Not overnight, not magically, but steadily, safely, and naturally. These 5 exercises are not about forcing your bladder to behave. They're about helping your muscles, nerves, and circulation work together again the way they were designed to. When that happens, your bladder doesn't feel so urgent, your body doesn't feel so reactive, and your nights become quieter. Even if the change is small at first, 1 fewer bathroom trip, less panic when you wake, falling back asleep faster, that's progress. And progress compounds. Better sleep leads to better energy. Better energy leads to more movement, and more movement supports better bladder control. It becomes a positive cycle instead of a frustrating one. Be patient with yourself. Be consistent, but gentle. And remember, you don't need to do everything perfectly to benefit. Just showing up for your body each day is enough. If nighttime urination has been stealing your rest, I hope this gave you something empowering. A sense that you can take action safely, starting today. And if this helped you understand your body a little better, share it with someone who might be quietly dealing with the same problem. No one should feel alone or ashamed about this. Sleep matters, rest matters, and you deserve both.